Go.
Hello, my name is Owen Kelly. I'm a physician assistant at Signature Healthcare Brockman Hospital. With me today is my colleague Tara O'Mara, fellow physician assistant, Dr. Philippe Vulsteek, and registered nurse Jill Brierly. Jill, you'd mentioned to me once that your son was diagnosed with rheumatic heart disease. Would you mind telling us a little bit about his story, what age he was diagnosed, how the diagnosis was made, and some of the signs and symptoms he was exhibiting?
Sure. So my son was diagnosed at the age of 12 with rheumatic heart disease, or RHD, and he had symptoms of chorea, specifically a Sydenham's chorea.
Well, tell us a little bit more about that.
So Sydenham's chorea is where the body makes uncontrolled movements, like seizure or epilepsy type of movements, and at the time his pediatrician was unable to make a diagnosis based on those symptoms. It wasn't until sometime later, after we were referred to a pediatric cardiologist and they ran all sorts of tests and then finally did an echocardiogram, that a diagnosis was made for rheumatic heart disease.
Sounds like there was quite a bit of a delay reaching the diagnosis. Tara, what do you think about that? What do you think are some of the major problems with the delayed diagnosis?
I think there's a huge issue with the delay in diagnosis of rheumatic heart disease. I mean, if this goes undiagnosed, then potentially down the road, these patients will develop heart failure, stroke, just sudden death out of nowhere. And that's not even to mention any of the day-to-day symptoms that someone with rheumatic heart disease would experience. More like chest discomfort, easily fatigued, short of breath with exertion typically, and feeling like your heart's racing, palpitations. And the sad part about this is that it typically starts with something as trivial as a sore throat, which is due to most likely a strep infection. Very easily treated and completely avoidable. So it's definitely something that we need to work on preventing.
Yeah, it sounds like, a lot of those symptoms you mentioned are actually very non-specific. So how do we get to the diagnosis?
So it's not easy to make a diagnosis at all, and it's very dependent on having a well-educated provider. There is a set of criteria that we do use called the Jones Criterion, but again, the criteria is very specific. For example, who has really seen chorea before, as you mentioned, or the typical skin nodule or rash that's diagnostic of the disease. These things aren't seen very commonly at all, so it takes a very trained eye to recognize these things. It's also the fact that many children do suffer from a sore throat, but not as many have the more joint pain, bilateral leg swelling that's typical of the disease.
Sounds like we probably need something to make this simpler.
Oh, I think
Yes.
we definitely do, for sure. And if it's not suspected early, you're looking at a ton of complications down the line. And it's not necessarily an issue for us in developed countries, but it's still a very big issue in developing countries around the world.
Dr. Vulsteek, what are your thoughts?
Well, that is correct. It is a real problem in the developing countries, and estimation, this is only a rough estimation, is that probably 2 or 3 in 1,000 children in the age group between 10 and 16 years old may have rheumatic heart disease. Now, most of them, of course, don't know it, and are, for this reason, at risk for developing strokes at a very young age, heart failure, and other complications.
Now, you mentioned developing countries, and you mentioned India specifically. So let's take India, for example. So if there's about 1.2 billion people in India, and about 15% are in the age group you mentioned, that's 500,000 kids, and that's not even taking into account the other developing countries of the world.
That is true, and that's why we have developed our initiative called the Healthy Heart Initiative, with the purpose of developing a tool, a questionnaire basically, that could be used in schools all over India, and we plan to do the same thing in Nepal for now, that would allow us to see if there is a suspicion, if any of those children have a suspicion of getting or having this disease, and if they do seem to be at high risk for that disease, we would offer an echocardiogram, which could then confirm the presence of rheumatic heart disease.
What are some of the hurdles you've come across with your research?
Well, the big hurdles, like most of the times in developing countries, are lack of fund, lack of infrastructure, and that's where the Healthy Heart Initiative is going to help, I think.
Sounds like a worthy cause to me.
I do think so.
Most definitely. Mhm.